just being completely honest, I think there were challenges with me being a woman in an IT industry. And I think those challenges are still there today. I don't have that at my current company at all. But I think just in the industry alone, there are times even now I'll go to a vendor event and the vendors that are talking, if there happens to be a man with me or standing by me, they'll talk to them, assuming that that's the individual to talk to. So I have to kind of step up and say, no, hey, I'm actually the CIO, and can we have a conversation? So it's interesting.
Welcome to the CNL Podcast, where we dive deep into the minds of IT and security professionals to uncover their experiences, challenges, and best practices in today's ever-evolving tech landscape. I'm your host, Sedric, show up, show out, Lusant, also known as your cyber expert. And today I'm thrilled to welcome Briana Brown, Chief Information Officer at Denova Collaborative Health. Thanks for joining us today, Briana. How are you doing?
Thanks, Sedric. I'm doing well. I really wish I had a better intro like yours. Yours sounds really cool. Mine doesn't sound that cool at all.
Hey, I have to read it every time. Otherwise, I'll mess up. But can you tell us a little bit about your background and how you got started in the world of IT and security?
Yeah, absolutely. So my career in healthcare actually started in an operational role, and worked in revenue cycle and just general operations in healthcare. While I was working for a small community hospital, they were going through an EHR transition. They were migrating to a new one. And that's where I got my first taste of IT. And, with small community hospitals, everybody's wearing multiple hats. You're multitasking, you're doing everything. It was strange. I worked in revenue cycle, but I actually reported to the chief nursing officer. Yeah. You said we wore multiple hats. We did. And she was amazing. She was one of the coolest people to work for. It gave me some insight into what it feels like from the provider perspective, dealing with an EHR migration and not having the technical background. Back then, that was right before the meaningful use era. It was a huge change. It was a huge shift. I got my hands in IT. I started helping with the data migration, and I was helping with the configuration, and I fell in love. I realized that's where I wanted to be. That's where I could make a change, where I could make a difference. And it showed me that I could have the best of both worlds and work in a technology space. And I think that's what still makes me different today.
That's awesome. Were there any specific challenges that you faced when you were trying to climb the ladder to become a chief information officer?
You want me to be honest?
Our listeners want you to be honest. Our listeners, they want to hear the real truth. They're not coming here for no sugar-coated, politically correct. Like, we get it. There's always some type of challenges, but from your perspective, for what you can share, what you're comfortable sharing.
Yeah. I think the initial challenges that I had were personal growth, trying to technology, understand the environment. I was young and dumb and aggressive. And I really wanted to climb that ladder. I wanted to be at the top within a year, and, totally unrealistic. But I think that also made me good at what I did because I wanted to learn. I soaked up everything like a sponge.
Ambitious.
I wanted to make a difference. I wanted to feel like even the smallest thing I did was making an improvement, making something better, making somebody better. So I think the initial challenges were on me and just my lack of understanding of how things were going to progress in my career. And then I think the challenges started with, sometimes it's my age. I think it's not a problem now, but back when I was younger, I think, some would look at me and go, oh, she's just a kid. What does she know? Or she's too young. What does she know? And I think those were some of the challenges. And then just being completely honest, I think there were challenges with me being a woman in an IT industry. And I think those challenges are still there today. I don't have that at my current company at all, but I think just in the industry alone, there are times even now I'll go to a vendor event and the vendors that are talking, if there happens to be a man with me or standing by me, they'll talk to them, assuming that that's the individual to talk to. So I have to kind of step up and say, no, hey, I'm actually the CIO, and can we have a conversation? So it's interesting.
Yeah, definitely. I can resonate with some of those challenges, especially when I first was breaking into the field and getting out in front of clients. That imposter syndrome just kept kicking in. Do you really know what you're talking about? Even though I know I've done the work, I've been around the block, got a degree, all that good stuff. And it's just sometimes it's still that voice of the limiting beliefs comes up sometimes. And I believe it plays a lot of professionals. Now, on the other side, I wish this wasn't such a predominantly male field. I know there's a lot of good organizations like Women in Tech or Women in
Yeah.
Cybersecurity that are doing great things to help close that gap. But I can definitely understand where you're coming from there. From your day-to-day as CIO at Denova, what does that look like in your current role?
A lot of innovation. The best way to describe it, even though Denova's been around for years, we went through a name change, but Denova's been here for 30 plus years under a different name. And we changed names about a year and a half ago.
Is
Feels
Denova just a regular healthcare provider, hospitals or primary
We're-
care?
We're outpatient integrated health. So we do primary care and mental health care.
Okay.
Probably, I'm going to say roughly 20% primary care, 80% mental health. So we have psychiatry and behavioral health therapists. We are predominantly virtual. We have multiple physical locations, but during the pandemic, we flipped and really did an amazing job. And I can't even take the credit because that was before I came on board here. But they did a phenomenal job of being able to flip that switch and really continue the same high level of quality care for the patients, but virtually.
Yeah.
It's been phenomenal because even after the pandemic, most of our patients still want to be virtual. It's just convenient.
Yeah. You don't have to stay stuck in traffic for 30 minutes to an hour, round trip, going there and back, where now you can do a lot of the forms digitally and get to see your provider digitally and hang up and be right where you need to go. That's awesome. And yeah, a lot of businesses, I saw a big shift. Every business had to make that shift in order to keep the lights on, right? Keep food on the table. And if you didn't, you realized you had to find ways to innovate, to make it happen. So everyone started using Teams or Zoom or something to facilitate providing those services in a remote aspect. But that also introduced more attack surface for some of these hackers, as you heard, like some of these hackers were doing Zoom bombing or whatever, just basically just getting in the rooms that weren't secured with any codes or anything like that.
Well, even if it's not full on hacking, you've got, now that so many people are virtual, you've got assets that you have to worry about. I mean, there's so much around security now that, if I were in the office, leaving my computer, not traveling with it, not working remote, you knew I was in a secure environment. My printing, my documents, everything was here in a contained office. And now most of our workforce is virtual. So they've got laptops going everywhere with them. They have, if they're printing documents, is it secure? Their workspace even, do they have people walking around? Are they listening? Are they hearing? Can they see what they're doing? So, I mean, there's so much more to think about with cybersecurity now that most of our workforce is virtual.
Yep. Ever new challenges to deal with, but it's like you're balancing innovation with security, trying to make sure your users have what they need to do their jobs comfortably and efficiently, so they don't just skate around your controls regardless. It's not a battle for the faint-hearted. So I can definitely resonate with that because the attacker just got to be right once. That's it. You got to be right 10 times out of 10. So how do you approach building a security conscious team and culture there, since you're spread out and so remote and you got a lot of different irons in the fire? It's funny. I had that happen to a guest just yesterday. We were in a mid show and it cut off. But yeah, again, just how do you approach building a security conscious team and culture there with so many irons in the fire, remote, in office, you're trying to balance innovation with security? How does that go about?
Well, for us here, Denova grew really fast. And even just in the time that I've been here, we've pretty much doubled in employee base, which it has only been 2 years. So that's phenomenal growth.
That is great.
Yeah, I love it. But it keeps us busy and keeps us moving. And we're actually in the middle of migrating to new EHR as well. We just kicked off that project a few months ago. So our best way of trying to get ahead of cybersecurity events or any kind of incident related to that is education and communication. And the end users, our teams, our customers, the people that we serve, they get tired of hearing from IT, and I don't blame them.
Yeah.
I get tired of hearing from my bank. I don't blame anybody for looking at my emails and going, oh my God, it's another IT email. So I'm lucky to have a really amazing, innovative, creative team. They're quirky and fun and super amazing, and they find ways to make things more interesting. So, they've built out a SharePoint site and built out tidbits and hints and tricks and guides and all of these things to try to get users interested in going and getting information. They use a couple of different tools to put together training material that also have quizzes and make it fun. And it's kind of
engaging.
Quizzes that are in it are kind of like a game. And so you're competing with other people to see who gets the most points. And so my team built all of this stuff to try to make security and IT
a little bit more fun.
I think education's our first way to combat this.
Yeah, and I can definitely agree with you there, because at the end of the day, you're only as strong as your weakest link. Your technical assets on the perimeter and whatnot, those can be fixed with patches, have endpoint protection, some sort of technical controls.
Exactly.
Right? But at the end of the day, the human firewall person who's going to stop from clicking that link or running that malicious payload and giving access to any potential threat actors, it starts with them being aware of these threats. And when you gamify, it does make it more, because I've been to so many different security trainings and I've given security trainings, and I can see when I've bored people and when I've taken certain trainings that I've bored people to death, or death by PowerPoint or slides, whatever the case may be. When you gamify it in some way, it makes it a little bit more intriguing than the regular compliance training. So definitely kudos there. So what's one piece of advice that you would give to other security leaders that are facing the same challenges that you are?
Don't try to tackle everything at once, because it will overwhelm you and your team. It overwhelms the entire organization because you're spitting too much at them at one time. I think for us, it was important, especially when I was first coming on board, because I'm trying to assess the environment and trying to figure out what I'm walking into. And so for us, we put together a list of, here's everything we got going on. And, here's the things that are kind of broken that we need to fix. Here's the things that they're working, but we'd like to make them better. And here's the things that we don't have anything for. There's a gap. So we put together our risk assessment and really tried to go down it and triage it and understand where we stood. And then for me, it was important to take that and then go and have a conversation with my CEO. And I'm lucky. I've got an amazing CEO who understands enough about technology that it never feels like a brush off. He's really interested. He wants to hear and understand what's going on. But when I go to him with, here's our things, our stuff that we need to work on, but here's the top priorities, and here's why it's a top priority. It's a major risk to us, or it's already an issue and we've got a gap here. Having that conversation with him and then explaining to him what we need to spend on that, it never feels like a battle, because we go into it with, I help educate him first, help him understand where we're at, and then I help him understand how we got to the cost that we're at, that we're going to have to spend. And it's an easy discussion. It's an easy conversation. And I think that's important for leaders to be able to go in with that mindset.
I gotcha. Yeah. So not trying to tackle everything all at once, focus on the basics, the fundamentals, right? And figuring out where your risks are actually at. Like you said, you got to build that risk register and figure out, what do you actually need to tackle? What's the impact if you don't tackle it, if it's exploited, or whatever the case may be. And also having that buy-in from your CEO definitely makes things easier, because if it's brushed off, it feels like an uphill battle, and you can do so much if you're not being supported by your counterparts. So let's kind of switch gears here. What's one piece of advice that you would give someone who's just starting out their journey into IT and cybersecurity?
Don't be afraid to make mistakes. Don't be afraid to make educated mistakes.
Are you done your due diligence?
Mistakes just because you don't care, or you're not taking time to think it through, that's a whole different conversation. But making mistakes because you're invested and you're working really hard and you're being innovative, or trying to meet the need quickly, or whatever the case is, if you're invested and I see that you've worked really hard on something, but you made a mistake, that's a whole different conversation than if you didn't do anything at all, or you made mistakes because you were careless. I tell my team all the time, I love it when they come to me and say, hey, I am really sorry that I accidentally did X, but here's what I was trying to do. And when they paint the picture for me, I'm like, oh, it's okay. We're going to get over that. And here's what we're going to do. And, Did you learn something from it? And they're like, yeah, great. Then you did
Lessons
your
learned.
job. You learned something from it and nobody died. The company didn't crash. We're going to move forward. We're good. So making educated, calculated mistakes, it's the best way to learn and grow.
That's right. Now, educated mistakes, not CrowdStrike type mistakes. For those who aren't aware, there was an incident in IT hours of CrowdStrike. You can go look that up and learn more about that.
Yes.
What do you think are the most important skills for professionals to develop in this space?
Well, this will be controversial.
And we love it.
I think it's people skills. I mean, we have so many professionals that are coming in straight from college or some sort of certification that they just got, and they get heads down and focused on the work. They think about the widgets or the things that they're turning and the things that they're doing and forget that the end result is impacting somebody. Whether you're in healthcare or not, it doesn't matter. You're impacting somebody's day to day. The thing that I try to bring back to everybody, especially in healthcare, finance is probably another really good one, but healthcare, it's so easy for IT to forget that we're impacting not just the people we work with, but we're impacting your mom, your brother, your sister, your dad, your grandfather, your wife, your husband. Our patients are those people, and that's who we impact every day. That's important to me. If I can get somebody, if I can hire somebody who doesn't know the first thing about the applications that we support, but they have people skills, communication skills, they have good work ethic, and they want to learn, they want to be a sponge, I would hire that person before I would hire an expert in an application who has no people skills, no communication skills, because I can't teach those.
Yeah.
I can teach you the application, but I can't teach you how to care about people.
You got to have those soft skills to understand how to communicate to the audience, tailor your messaging to the audience you're talking to, and how to interpret and process highly technical information, tailor it to that specific audience.
Exactly.
And have the emotional intelligence to tell when should you pull back from something, when should you revise your approach, things along those lines. It's definitely some of the key things I've witnessed, that being a reason why some people weren't fought for when it came time for certain layoffs or some things like that. And it's definitely an underrated skill, I believe, but it is one of the most important skills besides having the technical competency. So I can definitely understand that. So let's switch gears here, something a little bit more lighthearted. So when you're not running things over at Denova, what do you enjoy doing for fun?
I love to travel. I actually went to Vegas for New Year's. It was it's a little too crowded for me, but I love to travel. I love to sightsee. I'm new to Arizona still. You know, I've been here a couple of years, but I'm actually from Tennessee. So
I'm from the East Coast.
Yeah. So Arizona's kind of cool for me because everything still feels new. I still get to go around and see things. Even the sunset and the sunrise here is just amazing. So travel is number one. Music. I love music, going out and listening to music or dancing. And
yeah,
I can't sing, but I think I sound really good in the shower.
Doesn't everybody?
Yeah, definitely. Spending time with my family and friends and just really being able to watch my kids grow. That's amazing to me.
That's awesome. Yeah, I haven't been over to Vegas or Arizona yet, but at some point in time, I'm looking to make the trip over there. Maybe I have a client over there or something, but I try to blend my travel in with certain engagements with clients because you get two birds with one stone.
It's true. That's true. You need a client then, because I understand that the MMA fights in Vegas are like
insane. That's the capital. And that's what I'm working towards, to eventually get the big fights in Vegas. That'll come one day. But thank you again for coming on the show and sharing your incredible insights and experiences with us today. It's really been a pleasure. For our listeners that would want to connect with you, where can they find you?
Find me on LinkedIn, look me up, send me a message, or connect with me, either one. Happy to network and see how we can all help each other.
Fair enough. For our listeners that are brand new, don't forget to subscribe to CNL Podcast for more conversations with IT and security leaders like Briana. Until next time, stay safe, stay secure.